So, Martha gave me the assignment of what are some of the strategies that we can think about, and this is my modest effort. So what can we do to improve the odds of getting publicly financed and universal health care in Vermont? We have to push our gubernatorial candidates to the wall on this one. They need to publicly declare that they are for a publicly financed health care system and that they are ready and willing to get it done. This is one of the most important elections we've faced in a long time. A governor who believes could put wind in the sails of real reform, but a non-believing governor won't give it a chance. It takes both the legislature and the government and the executive to make it happen. And even a unified government doesn't guarantee reform, to wit, the experience we are now seeing at the federal level, even with the Democratic control of Congress and the presidency. We need to put up candidates in every part of the state where there has been resistance from legislators to pursue a larger reform. In the legislature, how about constructing a Medicare for All healthcare caucus? Similar to the special interest caucuses in Congress, such as the Black Caucus, the Blue Dog Caucus, and others. These caucuses could be a force to reckon with in the legislature. They could hold their own hearings and keep the pressure on. Their visibility would be in stark contrast to the fiddling and diddling of the Health Reform Commission and the House Health Care Committee. Another thought. Over the years, I've been visited at my home, as you have, by people espousing one cause or another. Energy, Vermont Yankee, religious preferences, voting processes. But I've never been visited by someone who is part of an organized effort to change healthcare. A statewide canvassing of all citizens over the next couple of years could go a long way into convincing recalcitrant legislators that it is in their best interest to promote change. Or even targeted convincing in places that elect our legislative leaders could go a long way. And toward that end, earlier this morning, I saw an ad in the Addison Independent which did just that. It targeted their local leaders and the chair of the House Health Care Committee. What else do we need to think about doing? One of the problems with this subject is the enormity and complexity of it all. People want change, but they don't know how to grab hold of it or where to begin. I have thought that the McFawn Hospital Security Bill would have been an excellent place to begin. Here's why. It's doable. Global budgets for hospitals? If I were a hospital administrator, I'd welcome this development. Why? It's a more predictable way to know what my revenue for a fiscal period will be. It allows me to plan ahead for an entire year. It allows me to spend my expensive time and energy on providing great health care rather than managing money machines. It means I don't have to waste time and money on advertising and competing with other hospitals for revenue. I don't have to waste time and money on utilization review or determining eligibility for services. I now can ask healthcare questions when people come through the front door of patients rather than what insurance do you have. And for the people of Vermont, they would not have to worry about a medical event forcing them into bankruptcy. Nationally, that number has now reached an astounding and shameful 62%. It would mean the end of the $5,000 to $10,000 deductibles. It would reduce my premiums in the order of 40%, and it would give Vermonters one of the most important things there is in life. peace of mind. For our business community, it would reduce their premiums greatly. It would give Vermont businesses a major competitive edge by taking a major burden off their backs. And it would lower my workmen's compensation costs by about 15%. For the citizens of our towns and villages, it also obviously would reduce their premiums. It would also help moderate my property taxes, as the healthcare premiums for teachers and municipal workers would decline. But there is the most important short-term thing that I think we could do in Vermont is to get on with a broad economic study of the costs and benefits of universal health care and hospital care as a subset. The legislature put this requirement in law several years ago for the legislature itself to undertake such a study. It was made part of the big bill, the Appropriations Act, and they ignored their own lawful instruction. I was Secretary of Human Services for almost a decade under Governors Snelling and Dean. And if I had ignored such a lawful requirement, I would have been fired. But yet the legislature ignored its own law and got away with it. Such a study would document the overall economic impact of universal coverage and public financing. We would learn, for example, how many businesses could set up shop in Vermont if health care was universal and at reasonable price, and what the economic edge would be in the marketplace, and what that edge could do to our overall economic vibrancy and revenue enhancement ability, which could also offset much of the cost. It would be a measure of our economic vibrancy. We need to do this. It's been put off too long, because without those facts and that perspective, it will be hard to get it done, even harder. We could also bring to life the immoral waste of resources of this non-system. People need to graphically see and understand the character of the waste. Organize visits to doctors' offices, for example, by groups of citizens to see firsthand the 40% factor of overhead in their offices that physicians have to have in order to keep track of the complex individual payments, collections, and money seeking that these offices must endure to keep the doors open. We also need to drive home the impact of our shrinking cadre of primary care docs, the backbone of any good health care. People need to know that within 10 years, we will be losing many of the doctors through retirement and dissatisfaction. We could publish, for example, the size of waiting lists for practices, which are even now growing. The fact that the largest number of our primary care docs is over 50 years old and will be leaving us soon, many because of their unhappiness with their current paperwork, heavy circumstances, should be used to help awaken our citizenry. We also need to pass a bill that takes the planning for future health care out of the hands of the legislative committees, whose members, by and large, do not have the experience, scope, or time and energy to fully understand the mega and complex issue of health care. The legislature needs to empower a panel of both experts and informed citizens to undertake the planning of a bill that results in an up or down vote on an entire comprehensive bill. And if that vote is nay, then it's back to the drawing board until a comprehensive bill can gain approval.